show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only. Today's show is a compilation of prior shows' recordings. Thus, there are no call-ins today. Join us next week for another exciting, informative call-in show. Until then, have a healthy week. This is WMNF Tampa, 88.5 FM.
Let's get Robert on the line here. Good morning, Robert.
Yes, how are you this morning?
Great. How are you today?
Oh, not too bad. I have heard that long-term use of it, I would say not so much medically, like it's prescribed, but just, it gives a psychosis to the brain after long-term use. And I guess as you've seen in movies and things like Cheech and Chong, that they're just slowed down. Their brain is just not speech, everything. There's always been the long-term, pothead, and they just sound drugged up. So I don't know what your take is on that, but psychosis, it's not really good for the brain.
That's true. And actually, that's a very good point. Psychosis can occur in people that have certain genetic problems with a couple of receptors. The research is out showing there's a very small group of people that doesn't respond very well to the cannabinoids, the phytocannabinoids, because their body just doesn't respond the same way as other people's, and they can actually induce schizophrenia. It has happened. It's very rare, but any sedative chemical, when used on a long-term basis, can just keep you sedated. The interesting thing about cannabis, though, is that for, again, about 95 to 99% of people, it's not addictive. And the addiction has to do with the nature, again, of these receptors and whether people actually respond overly to this chemical. But so, yes, it is a risk, but in general, most people do not have this problem. Most people will not develop psychosis with these medications when used medically or even used recreationally. But if you do a lot of it all day long, yes, you might be sort of dull because it does kind of put a blanket on the brain. Good point.
Yeah, because, it's very easy to also obtain alcohol. And if people are doing marijuana, let's just say they make it recreational in Florida, which I think would take quite some time because of the politics, is that you're going to have people really out of their mind operating, heavy machinery, cars.
Robert, let's get real about this. Yeah. We already have people out of their mind operating machinery because we have a psychotic prescription mill that constantly puts people on antidepressants that aren't antidepressants. They're just chemicals that alter the brain chemistry. They're also probably taking benzodiazepines. They're probably taking other chronic pain medicines like seizure medicines like gabapentin, and they're probably on opiates. When you look left and right, when you're driving down the street, it's likely the person next to you on either side has 2 or 3 medications on board because America consumes 55% of all pharmaceuticals and 70% of the opiates. Actually, when you use cannabis, it reduces opiate and benzodiazepine use, and people actually get better. This is a functional, healthy tool and should be available for public use and should be promoted more to get people off the so-called antidepressants and the pain pills and the so-called anxiolytics like benzodiazepines, because this, with therapy and good food and good exercise and good relationships, will improve people better than those other chemical Band-Aids. Well, thank you, Robert, for your opinion. So Jerry sent an email, and he asked, is there a vitamin or supplement that can help with alcoholism? Well, I was talking about the apicurb. I think that amino acid support for your neurotransmitters so your mood is better and your cravings are lower is useful. I've seen it help. I think that abstention first, counseling in addition. Support groups are all useful. And even sometimes medication may be needed to help with that. And so, that's just a difficult situation to deal with. While you're doing that, though, a good multivitamin with the Bs, especially thiamine, and some milk thistle and N-acetylcysteine to help do its detoxification. So fat-soluble vitamins, just starting them. Vitamin E is the first one I want to mention. It's got 5 different forms. It's got alpha, beta, delta, and gamma tocopherol. And it's got also alpha tocotrienol, all in the vitamin E family. And tocotrienol seems to be really, really, really useful at heart protection. But overall, we know that vitamin E is helpful in neuropathy and multiple sclerosis, Parkinson's disease, vascular problems, diabetes, liver problems, dementia. It's safe. Very safe. There has been some mention that possibly blood pressure would go up when using it, so monitor the blood pressure. And if on anticoagulants like Xarelto, or Brilinta, or any of those blood thinners like Coumadin, warfarin, you should watch how you're doing. If there's any extra bleeding, it could be because you're taking extra extra vitamin E, because it does tend to make things a little more slippery. Food sources, or actually doses, 100 units to 1,200 international units. In people that have clotting issues, 1,200 units can be useful if you don't want to take a clotting medicine, but that's only if you don't have AFib. Wheat germ oil, sunflower seeds, safflower oil, almonds, sesame oil, peanut oil, olive oil, butter, spinach, and oatmeal all have vitamin E. I think we have caller.
Good morning, Rita.
Good morning.
Hi, Rita.
Hi. I have a friend who is 73, and he had one kidney removed for cancer, and now his second remaining kidney is in stage 3 kidney disease. And his primary care doctor doesn't seem all that concerned about it. I think he needs to be followed by a nephrologist and possibly be put on a kidney transplant list. They don't seem to make any recommendations. They just say he's doing great. And I'm wanting more to be done to extend his life. And I wonder...
I think you're right on it there. That's very true. I mean, when you have 2 kidneys and your kidney function drops, your filtration ability drops to the point where you're considered to be in chronic kidney disease. And it goes in stages. And truly, stage 3A chronic kidney disease is not bad. There's almost no consequences from that. However, it can get worse, easier than if somebody doesn't have kidney disease. And so, from even in my practice, when I see someone with 2 kidneys with stage 3A kidney disease, I have them visit a nephrologist once that diagnosis is made, because they actually have a specialty-related illness. I tell them that with their 2 kidneys, when they see the doctor's going to say, you don't need to see me for another year or 2, because they don't really have much worry about it. So, somebody with 1 kidney, though, who's gone into stage 3 kidney disease, really needs a nephrologist to be following them, because an injury, an illness could actually make that kidney get suddenly worse. And so I think it's really important when you're in this situation to have all that followed up. And the kidney doctor probably will want to see that person more than every 2 or 3 years. And yes, you're right on it. So get them to a nephrologist.
Okay, no other recommendations besides that?
I think the best thing to do is just to get to the nephrologist, but also be aware of over-the-counter medications, mixing with pharmaceuticals that are also prescribed. Because with 1 kidney, you have to be really paying attention to what you're putting through it. And you need to make sure you're getting lots of water to stay hydrated, to make the filtration work well. And So, and also at this point with one kidney and stage 3A kidney disease, you want to be paying attention to the amount of protein being taken in.
Right. Yeah. I see everything online that says for the diet, but it all tells about what not to eat, which it makes it look like there's nothing left to eat, but rice and,
No, you can eat a whole
protein, low potassium.
Well, but you don't have to go that low. That's the whole thing. I think that if a Mediterranean diet is used, then you get 80% plant, 20% animal, or even 85% plant, 15% animal. That's going to protect the kidneys.
Hello, all you loyal fans of Dr. Fred Harvey. This spectacular Monday morning, you are listening to a special rebroadcast of some of the clips composing the Best of Healthy Step Show.
So here's an email. Diane says, my 29-year-old daughter gets a lot of urinary tract infections, maybe one every 3 or 4 months, and then she is prescribed an antibiotic to treat. Is there anything she can do as a preventive? So urinary tract infections indicate that you do have a breakdown in your barrier at the urethra, where your urinary tube basically exits the body. The urethra in women is short. Maybe half an inch, something like that. And so it is much easier to get bacteria into the bladder and cause an infection. It's very close to an area of moist skin, which contains a lot of bacteria, and different types of bacteria can colonize that area, especially fecal bacteria. And they're the ones that often cause the infections, things like E. coli and Klebsiella and things that show up in the stool and not usually the vagina. So, things that people can do to really help with urinary tract infections, make sure they drink a lot of water. You want to drink at least a half ounce of water per pound of body weight per day to flush the system. You also, for women of childbearing age or any age, honestly, sex is an issue. Rubbing on that area can actually introduce bacteria. So women who get frequent urinary infections often find that it is after a night of sex. And so they may want to actually do some washing immediately after, urinate immediately after sex, maybe even wash before sex to make sure that the bacterial load is lower beforehand. If husband is circumcised, make him clean underneath the foreskin to reduce bacterial load. All of these things can actually help. And also, vitamin C is a very good skin integrity helper, but it also helps with the immune system, and it will help acidify the urine, which will help keep lower counts of bacteria there. Some doctors will prescribe a bacteria to take or a antibiotic to take one pill after you have sex to prevent that. And also taking a good probiotic may actually shift the bacteria in your system to a more beneficial group of bacteria that would then potentially reduce any possibility of further infections. I think those things would be all very good to help. And even increasing the amount of water to, closer to an ounce per pound if you really have a lot of problems with it, or if you work outside and get dehydrated. I think we might have a phone call.
Oh, we've got more. We've got a little garden of phone calls here. We'll start with Carlos. We've got Jamie and Rochelle. So, good morning, Carlos. How are you doing today?
Yes, good morning. Well, thank you for taking my call.
You're welcome, Carlos.
Hi. Hello, doctor.
Hello.
I have 2 questions, one personal and the other one is kind of general as far as what's happening
Yes.
in the world. The personal one is that I have a low count of red blood cells. For the last 10 years, I've had low counts of blood cells of other types like platelets and white blood cells. So it's been going up and down, and the most recent has been only the red blood cells. So I went to a specialist in,
Hematology?
basically, they couldn't find it. They couldn't figure out what it was, and I'm still living with it. It doesn't cause much problems, but I feel kind of with no energy. So it may be because of the low red blood cell count.
So how old are you, Carlos?
I'm 63.
So what you described is something called pancytopenia. Pan meaning all of them, cyto meaning cell, penia meaning low. All cells are low. They aren't all low all the time for you, though. And right now you have a low red blood cell count. And so that's called anemia. And you can feel fatigue when you have anemia. Is your red blood cell count very, very low? And is your hemoglobin hematocrit low? Or is it just a slightly outside of the reference range low?
I believe it's not very, very low.
Okay.
Yeah.
So that probably is not a source for your fatigue. More likely, it's the cause of your low red blood cells. So since you've had all your cells low, I think you have something bigger hiding in the background. This, at your age of 63, that could mean you have a bone marrow disorder, one known as myelodysplasia. And if they didn't find that when you saw the blood doctor, then you probably don't have that. And it's probably not a genetic disorder. My guess is you have an autoimmune disease or a toxic exposure. You can be exposed to lead and arsenic and mercury, and that can disrupt cellular function and production. But you could also have food sensitivities. Gluten can disrupt problems, and other autoimmune illnesses can also attack your bone marrow. So I think it's worth it to get a deeper evaluation, such as one that a functional medicine doctor would do, looking for deeper things, since you've been to the specialist in blood.
Okay. I eat a lot of fish. You mentioned mercury.
Yes.
Is that a possibility?
Absolutely. Yes. Fish is a toxic source for mercury, and you can definitely have toxic metals affect your blood count.
Oh, wow. Okay. All right. Okay, I have a second. It's more like a general situation.
Yes.
You've heard of the eye drops that have been really bad for people, that have caused people lose their eyes and even death. So I wonder why were those products in the United States? I believe they were manufactured somewhere else in a different country.
Okay, I'm not really aware of specifically what you're talking about, but if you have contaminated eye drops, such as there could be bacteria growing in it, there could be parasites. The source is hard to tell, but usually we have a very good screening system for getting rid of compromised product. But whenever you put an invasive bacteria in your eye, it's highly likely that you're going to get an infection there, and it could actually invade, since the eye is directly connected to your brain. It could go deep, and you could actually have a fatal infection.
Right. Yeah, I've heard that the FDA or whatever, the drugs authority, they were allowing medicine from India come over, and that's what I thought happened, because I think the regulations in India are not as stringent, and the FDA or they cannot really control what's going on over there across all over the other side of the world. So
no, they can't, but they can screen products that come in through customs and check to see if they're okay. And that's generally what happens. Occasionally mistakes happen. Humans are human.
Okay. All right. Thank you very much, Doctor.
You're welcome.
Yes, my jolly flock of aficionados, if these snippets of the show should sound familiar, you are right. You are listening to some of the greatest questions and answers from the Healthy Step Show with Dr. Fred Harvey. Because this special presentation is pre-recorded, I sincerely regret that we won't be able to take any phone calls today. But stay with us, because this rebroadcast has some listening treats so rare you'll want to keep them in the museum of your heart, in a parlor you love to visit called WMNF Tampa.
Let's go to Jamie in Brooksville. Good morning, Jamie. Hello?
Hello, can you hear me?
Hi, Jamie.
Hi. Good morning to all of you, and thank you for the show. I have a quick question. concerning. I've been trying to do some research on that. There's so many pros and cons. Several years ago, I had a condition. Basically, it was a retinal hemorrhaging, and they started to treat it as macular degeneration, but it's not exactly what I really had. But they said so that it wouldn't advance, they were going to treat it like that. So for a few years, off and on, I've been getting injections in my eye, and everything's kind of stable right now. It's not gotten any worse at the moment, but it's not gotten any better. Is there anything out there, any natural supplements that could help eye condition and eye vision? I mean, everyone, when I talk to the doctors, they say no, none of them really work. But then I see some other products on the market, and it says, yeah, you can get your 20/20 vision back. So I'm just wondering, what can I do to help at least maintain, if not improve, my vision?
Gotcha. So there are confused people on both sides. My former colleagues in traditional allopathic medicine do not understand anything outside of the illness care paradigm. So when they talk about something not working, they're not necessarily talking about a vitamin not helping you. They just have no clue on that. What they're talking about is that in the practice of conventional illness care medicine, a chemical is assigned a target, and then they study the chemical target interaction in a clinical research. And if they show that the chemical does something to the target that they want to have happen, then they consider it an effective therapy. And so it's a very narrow view of reality, and it's kind of delusional because biology doesn't work that way. It just appears to sometimes, and that's why they have to do these clinical studies to see if it has the appearance of working this time. And so when they say it doesn't work, what they're saying is they don't know anything about nutrition. They don't understand how the body works. They don't understand supporting systems to be healthier. But they do understand that it's not going to treat the disease that they're talking about right now because it's not been proven to treat that disease, because it never was designed to do that. It's designed to actually help a healthy body or help the body get back to health. And so, that's really the problem there. There are things that you can do that support eye health, but they're not going to be a treatment for macular degeneration or retinal hemorrhage because that's not what they do, and they never have. And we've never actually in alternative or nutritional or functional medicine talked about it as being a treatment. These are all supports for the system. The system treats itself because we know that our bodies have an innate intelligence that's healing, and it wants to get back to health. And if we just take the blocks away and give it some support, it usually does it. And so, yes, you can eat things like blueberries and bilberries, which is the European blueberry, and you can eat carrots, and you can have krill oil that has astaxanthin. We know that carotenoids, all of those beautiful yellow, orange, and red chemicals are very good for the eye. We know that fish oil is delightful for the eye. And we know that taurine helps support the protein structures of the eye. And we know that general antioxidants help keep the eye happy. Vitamin C even keeps the eye happy. High sugar doesn't. High cortisol doesn't. So if you want to get your eyes healthier, you meditate and get rid of some stress. There's so many things that have an impact on eye health, but it's just not eye illness that we're treating. We're actually promoting eye health. And that's what is the difficulty in communicating between a cogent functional doctor and a delusional disease doctor.
Okay.
Got it?
Yeah.
So
I've been eating carrots and all that other stuff. I just didn't know if there was a product, not necessarily as a treatment, but as a good healthy single supplement that somebody's.
There are lots out there that really give you some support, and even that relatively low level one that they did in the studies, and all the eye doctors talk about the AirReds plan. It's okay, but there are better ones on the market. If you go to some of the better nutraceutical companies, they've made their own version of AirReds and kicked it up a notch with all kinds of good stuff. I use one that's called capital I, and then sight, the word sight, eye sight. And it's really a nice combination that has all these really good antioxidants and supports that will help your eye be healthier.
Okay. That's what I need to know. Thank you very, very much for the info.
You're so welcome.
Bye-bye.
Well, and thank you, Jamie. And waiting patiently is Rochelle, another loyal caller and listener. Good morning, Rochelle.
Good morning.
Hi there.
Several years ago, I went on a low-carb, low-calorie diet. 1,200 calories a day, 50 grams of carbs. And I was very successful, like everybody is when they follow that diet. I lost about 40 pounds. When I started incorporating some of the foods that I had cut out back into my diet, I started feeling sick. And I went to the doctor and they went through one test at a time. And eventually we found out that I was allergic to wheat, egg white, milk, and corn.
Okay.
Now, I've been trying to do a little, we're all working and families and everything else. So I'm limited on my time to try and research myself. I'm wondering if gut microbiome has anything to do with that, and what I can do. It's hard. When you've been able to eat everything your whole life and then all of a sudden you can't eat that, it's a difficult change.
It is a challenge, yes. I've been adapting my diet for the last 25 years. And it does take time, and we like things. And I admit, I fall back periodically. I really do a very good job of being gluten-free. But periodically, especially in food deserts, like traveling across rural Pennsylvania this summer, it was difficult to cobble together a meal that did not include some gluten somewhere, because even the sauce is everything. Gluten is ubiquitous. It's difficult to transcend that drama, but it is possible. It takes work. And I know it's hard when you are you have a family to deal with, because I did it with my kids and tortured them with disgusting gluten-free pancakes and stuff like that. But there are so many opportunities now around, since people have been working on this for 30 years. You can get good quality gluten-free products very easily. They cost more. They cost more than regular product, but they do actually work. And so it's possible to do this. Eggs, probably one of the harder ones for me, because it's a great protein source, but egg white is a reactor. And the thing is, I'm not certain that you have allergies, because you didn't describe you get hives and stop breathing when you eat the food. I think it's probably food sensitivity, and those can change. Like if you get rid of gluten, you might actually find that egg isn't a problem anymore, or that milk isn't a problem. I found that milk used to bother me a lot, but when I got rid of the gluten, milk doesn't bother me. I use raw milk now and without any problem.
Okay. I notice if I eat smaller quantities, or if it's incorporated into something else, then it doesn't seem to bother me. Wheat, I can't get away from wheat bothering me, and it makes me feel sick. I can't breathe, and a scratchy throat. Although it does seem like if I take a Claritin, then I don't have as many problems.
Well, yeah, you can cover up your own demise, no problem. The road to death is paved with Claritin. How's that?
Yeah. But you don't think that like probiotics or the gut health makes that big of a difference in that kind of thing?
Absolutely. So gluten will trash your microbiome and ruin your gut lining. So there's a place to start.
Okay. I got it. I just got to do my due diligence. Yeah,
really. We functional doctors have figured out that using health coaches is really helpful, because people get lost, and health coaches are actually trained to help you find solutions, to help you implement this stuff. I have two that I work with in my office, and I think it's a really valuable asset.
Okay. All right. I appreciate your help. Thank you.
You're welcome. Have a good day.
Bye-bye.
All righty. And we've got Scotty, who's been on the line here. He's in Largo. Good morning, Scotty.
Good morning. How are you?
Hi. Great. How are you?
I'm well. I'm actually calling about my wife. She recently had an endoscopy. Primarily, she was having some difficulty sometimes if she took her meds in the morning, just swallowing. And so while she was in for a colonoscopy, it was suggested that she also have an endoscopy to see what's going on down there, see if possibly it should be stretched or something. That turned out to be negative. However, they've diagnosed her with Barrett's esophagus and GERD. She's primarily pescatarian. She eats some fish, but and mostly organic food. Not overweight. Leads a healthy lifestyle. But in talking with some friends the other night, it was suggested that I think Dr. Eve, when she was still with us, had steered him towards an aloe product that seemed to be somewhat healing. I guess my question is other than abstaining from caffeine and chocolate and an occasional glass of red wine, garlic and onions and all the staples of the vegetarian diet, what else can my wife do to perhaps promote some healing and get over this, if there is such a thing as get over? So I'll shut up and listen.
So GERD and Barrett's, interesting combination. GERD is induced by things. I think it's often induced by histamine foods in people that don't tolerate them. So avoiding all those things that you're talking about might be useful, but I think I would look at a low histamine diet. Caffeine would be off that diet. So would tomatoes, avocados, strawberries, fermented cheeses, but not necessarily a lot of the vegetables that your wife likes. It needs to be explored a bit. I think it would be helpful. I, for one, don't use proton pump inhibitors in people that have GERD or Barrett's because there's one study from 2014 that showed that proton pump inhibitors may actually cause Barrett's to degenerate into cancer. And so even though they say it's going to help you prevent the GERDs from going into cancer, there's a study that shows that it goes the opposite direction. So I use famotidine, an antihistamine, an H2 blocker. It's a great way of actually blocking the histamine, reducing the acid, and getting improvement. Changing the diet and following all the instructions for preventing reflux, like not eating late at night, having 3 hours before you go to bed, and avoiding triggers like red wine and caffeine. Those all are very useful. And I think that the supplement you're talking about is called glutalamine. It's from Zymogen. It's a combination of glutamine, aloe vera, which has been deglycerated, or I can't remember. It's demannated. There's something in there that causes diarrhea. They've taken that one property out, and so it's not got the bitter diarrhea-genic property. So it's really soothing for the lining of the gut. There's some licorice in it, which is also very soothing, also deglycerized, so it doesn't cause hypertension. And this combination, I have watched Barrett's actually go away by using it 4 times a day, every day, before all meals and at bedtime. And doing it for about half a year. It might have been a year that time, but it's a really long-term course, and you have to be really diligent about the diet in the meantime.
Okay. And that's called glutatamine?
glutalamine.
Okay. And we can get that at the health food store?
You should be able to. And if not, there are certain pharmacies that carry it, and you can find a functional medicine doctor that carries it also.
Okay. Yeah, I had done some looking online. The aloe thing, I saw the study that, it's helpful in some cases, but it also referenced the increased chance of cancer, which didn't seem like a good option. So I appreciate your candor on that. So,
yes.
All right. I think you've answered my questions. I was surprised that strawberries was on the list. I hadn't pineapple and citrus and some of those.
Citrus is on the list. Pineapple is not.
Pineapple is
not on the histamine list. Citrus is, though.
Okay. All right. She's been staying away from pineapple since this diagnosis as well, so she might be okay to.
She might be, but I don't believe it's on the list. So go ahead and look and stick with the low histamine list. I think it's a good choice.
Okay. All right. I appreciate your help. Thank you.
You're welcome.
Well, thank you, Scotty. And we've got Gail and Gary on the line, a new Gary. So let's go to Gail. Good morning, Gail.
Good morning. My question is, I have called in before because I have extreme bruising. Any little tap on a doorway or a chair or anything, I bruise and I bleed very easily. I called in about a year or so ago, and you recommended BioStill. And I started taking the BioStill, and then I noticed all kinds of little extra things growing on my face, little bits of, I don't know. I decided that the BioStill was hurting me. And it didn't seem to be making any difference in the amount of bruising. And it's really extreme bruising. And I know it's called purpura or purpura.
Yes.
Do you have any other solutions?
Vitamin C. How are you doing with vitamin C intake?
I get it in my multivitamin. How much should I take?
Well, if you're having that kind of bruising, I'd say try and get 2,000 or 3,000 milligrams a day and see how you do with that. But bioflavonoids are also very good. Diosmin from orange skins. There's a bunch of companies that are making combination vessel care things. I think Designs for Health has a Vessel Care, and I think Orthomolecular has a Vessel Pro or Vessel Max, and they're basically combinations of different antioxidants like rutin from buckwheat and diosmin from orange skins, and these things are really shown to actually improve. The one Diovasc brand name, I've watched hemorrhoids go away in 3 days.
Huh? And how do you spell that?
It's antioxidant. So rutin, rutin, diosmin, diosmin. So look for those two specific antioxidants in formulas, and you'll find some good vessel care formulas.
Vessel care. All right. I'm going to try that. How long do you think it would be before I could see any sort of improvement? How long should
for what you've got doing higher vitamin C and some support? I'd say probably 3 months, maybe sooner.
Okay, great. I'm going to give it a shot. Thank you, Doc.
Okie dokie. And Gary has been. This is the new Gary. He's got a question about the long-term effect of Advil. Good morning, Gary.
Yeah, I'm a 60-year-old weightlifter, and I occasionally take a leave. Maybe twice a week sometimes. Is there any long-term effect of taking that just to help me through the workout?
So my question was, are you taking any curcumin, fish oil, boswellic acid, or other anti-inflammatories?
Oh, yeah. And I've gotten away from everything that is, I even stopped drinking beer just because I noticed it was, mostly my problem is my forearms. It just ache. So they ache. But I still do a workout that would take a 20-year-old, throw him into a grave if he's not been used to it. So it just knocks the edge off a little bit. That's all. And I mean, it seems like it gets the inflammation down too.
It does. So intermittent use of something like Aleve once or twice a week is generally not harmful for most people. Regular use in larger doses ends up junking up the kidneys, maybe the liver, but your body can usually tolerate small doses infrequently.
So once or twice a week, one tablet's not going to be a big deal.
Well, if you read the literature, one tablet could cause a fatal gastrointestinal bleed. One tablet out of the blue, and we have no way to predict it. But in general, what I've seen in 30 years of practice is that people tolerate Aleve really well. That's why it's over the counter.
Yeah, okay. That's what I wanted to know. I appreciate it.
Well, you're welcome.
All right, now, it's a pretty darn good show so far, you got to admit, but it is someplace between deja vu and a flashback. And that's because this is a pre-recorded show of some of the best of the Healthy Step Show with Dr. Fred Harvey. And because it's a pre-recorded show, I regret that we won't be able to take any phone calls today. But, by golly, next week we'll welcome you back like the prodigal sons and daughters that we love here at WMNF Tampa. Now let's get back to the fun at hand.
Okie dokie, and I'm hoping I'm pronouncing this correctly. We've got Ramil in Clearwater on the line and Carrie in St. Pete. Let's go to Ramil.
Hi, Doc.
Hello.
Hi. I'm a 72-year-old, and I have been diagnosed with osteoporosis. And
yes.
This gave me a a prescription which I had filled but I have not taken for Fosamax.
Yes.
And everything that I read about the side effects of it scare the you-know-what out of me. And I was wondering, with my blood work, everything else came back normal, except it said vitamin D, 25OH, total, and IA. I have no idea what that means, but
what's the number that goes with it?
21L.
21. Oh, okay. So osteoporosis means very low density to bones. And bone density is related to two things. One, the protein matrix of the bone. The protein matrix, the living, springy collagen matrix, is really important because that gives your bone resilience. And the calcium that gets attached to the matrix gives the bone strength. And so you have two different components there. If you and you need both to prevent a break. And the resilience factor, the collagen factor, that can be assessed. And most doctors don't do it because they don't think about bone metabolism. They just think about an endpoint diagnosis. But N-telopeptide, abbreviated NTX, is a urine test that looks at the loss of bone collagen. And we can track that in association with treatment intervention here. And so if you have a high bone loss, you're not going to be able to hold your bone. If you're losing collagen, you're going to have weak bones. And there's another test that can go along with that. It's called PINP, the pro-collagen peptide, that shows how much collagen your body's making. Those two I use to guide therapy in people that have thin bones, because then I know I'm going to be building the matrix that's so important. But here's the issue. You have vitamin D deficiency. That is a cause for osteoporosis. So the first line therapy for somebody who has osteoporosis due to vitamin D deficiency, otherwise known as rickets, you have rickets. Look up rickets. Nobody talks about rickets anymore, but rickets is a disease that before we knew what vitamin D was, in the 19th century, we described rickets. And that is where people get bow-legged because their bones don't actually hold together. Vitamin D is the treatment. Before you do anything else, I would get an NTX and a PINP, look at those levels, start vitamin D, and then see what happens to those levels. Because vitamin D deficiency is your disease, and Fosamax is not a treatment for that. Somebody should have considered actually treating the vitamin D. And for that low a level, you might want to do something in the vicinity of 125 micrograms a day, 5,000 international units for a while, but have your doctor follow that. You're in trouble with vitamin D deficiency.
Okay. 125 micro.
Yeah, it's a standard dose you can get at the health food today. But I think you need to have that followed by your doctor and let your doctor know that your vitamin D deficiency, rickets, you'd rather treat with vitamin D than with Fosamax. And maybe he'll agree with that.
Okay. I will try that. And the MTX and the PINT,
you could ask your doctor to order those. You could go to any lab test now and get them yourself if he won't order them for you. But Medicare or most insurance pays for them, so it'd be good if a doctor ordered it.
Okay. I will do that. Thank you very much.
You're welcome.
Thank you there. I do have Carrie on the line, but I want to remind folks that you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Good morning, Carrie.
Good morning.
Good day.
I had full knee replacement surgery 4 months ago, and I'm still doing PT because I'm being very aggressive with my recovery. I'm in great shape. I'm 66 years old. but I'm still frustrated that I'm not able to go downhill easily. So I'm going to continue the PT, but I'm still taking the Celexa. And my question is, am I okay taking this as long as I've been taking it? And is this kind of a normal thing to be able to not go downstairs as comfortably as I wish I could?
So tell me what happens when you try to go downstairs.
It hurts. It hurts, and my leg doesn't want to do it.
So where does it hurt?
It hurts kind of all around my knee. Like maybe you're implying the muscles aren't there yet.
There you go. And you say, my leg doesn't want to do it. That tells me that you have likely some muscle inactivation. And so sometimes when we have chronic pain, we favor things and we get things out of order. Sometimes actually it happens when we are in a surgical situation and muscles get interrupted. Sometimes it can be actually the source of the problem. And I think that happens in a lot of people. I think we get some muscle inactivation and our joints are not moving in the right fashion, and it damages the joints over time. So the pain you're experiencing now could be the cause of the joint destruction over time. I would consider, since physical therapy has been going on for 4 months, you look at a different way of dealing with the muscle function around that knee and find yourself a muscle activation techniques specialist.
Technique specialist. Okay.
Look up muscle activation techniques online. You'll find a website. And they have a practitioner finder there. In the Tampa Bay area, there are many of these MAT practitioners.
Practitioner, great. And what do you think about the Celexa question?
Yeah, Celexa has, if you've been tolerating it, it's probably something that you can tolerate. I don't know whether it's really helping with your pain very much there at all. Have you been taking omega-3 fatty acids?
I just switched from fish oil to omega-3.
Okay, so they're the same thing generally. So tell me about your omega-3. What strength is that omega-3?
I think it's 1,000.
And how much actual active omega-3 is in it? Because almost no omega-3 capsules have 1,000 in. My 1,000 milligram capsule that I take has got 900 milligrams in it.
Okay, I don't know. I don't have the bottle with me right now.
How many do you take a day?
1.
Okay, so likelihood is that's a 300 or a 600 milligram capsule, because that's some of the most common ones on the market. To get a 900 milligram, you have to search for it. Do you know your brand?
No, I don't remember. I just picked it up at the drugstore.
You want to look for a label on any brand that says IFOS. That's the International Fish Oil Standard. That's the highest level of cleanliness and accuracy you can find in fish oil preparations. So make sure yours has IFOS on it, and then try to get, generally for most people, anti-inflammatory effects will be really pushed if you get 3,000 to 4,000 milligrams of the actual omega-3 fatty acids every day. For a month, you'll probably notice a difference.
Okay. I will try that. I'll take both into consideration, and I appreciate your help.
You're welcome. Have a great day. Good luck with that.
Bye-bye. Thank you.
Okie dokie. Thank you very much there. And let's go to Carol in St. Pete. Good morning, Carol.
Hi, Dr. Harvey.
Hey there.
Hi. I have a couple of questions. One with heart. What type of oil do you think we should cook with?
Olive, grapeseed, coconut, butter. Let's see. Those are the avocado. It's another one. Those are the principal ones I use.
Thank you. And one of my neighbors who is even crunchier than me, he won't eat stuff out of a can. What do you think about eating out of cans?
I do it regularly. Look for BPA-free cans.
BPA-free. Okay. Just
you want to get the ones that don't have the nasty plastic inside.
Yeah. Say that again about the plastic.
You want to get the cans that don't have the nasty plastic liner.
Thank you. On the vitamin D you spoke of, does it help? Do we get enough vitamin D if we get out early in the morning and walk 20 minutes, or do we just really need the supplement these days because of the environment?
I've tested hundreds of people. I have had maybe 1 in 100 that gets adequate vitamin D from the environment.
You're wonderful. I would like to say every time I call that everybody listening should tell 3 friends about this program.
Yes, and thank you, Karen. I just want to remind everybody that if you're going to tell 3 friends to hit the tip jar, because next Wednesday is the middle of the fund drive, and we can get a head start on it. If you want to start today, tell 3 friends, listen to the archive, and plop something into the tip jar.
Cha-ching, absolutely. Good morning, Tracy.
Good morning. Hey, Dr. Fred, how are you?
Hey, I'm doing well. How are you?
Good. I just had some results, and I've been doing all my research. What do you know about the protein-creatine ratio? Mine is elevated at 287 or 0.7.
Actually, I don't really know much about that one. Haven't ever used it clinically. Just heard about it for the first time from you. Something I'll have to look into.
Well, it says to do B12 and cut your proteins down because insulin, it's not it's not processing it correctly.
Well, most people actually in America today are obsessed with protein, are eating too much protein. And protein excessive intake will actually induce diabetes and high blood sugar.
Excellent. That's what I'm doing. I'm doing a lot of protein. All right, then. Thank you so much. Have a good day.
You're welcome. So just as an aside, the routine recommended protein minimum for human adults is 0.5 gram per pound of body weight daily. Ideal body weight. So look at the tables.
Ideal body weight.
Yeah. Good luck with that.
There. Thank you. Have a good day.
You too. So let's see. I got an email from Pete in Indian Shores. Pete says, "Oh wow, fluoride in potable drinking water still a controversy to this day. Apparently, well, actually, it's really interesting that I think the Bay Area has a decent amount of naturally occurring fluoride in the water. In fact, I don't think Manatee County adds fluoride because they already at like 2.1 or something parts per million. And I think the goal for most of the treated water is like 1.7 parts per million in places that don't have any fluoride in their water naturally occurring. I wouldn't do anything more than what's naturally occurring in the water. I have not allowed fluoride treatments on my teeth for the last 30 years, and I haven't had a cavity. I use regular good dental care to prevent that. And I think everybody else can too. Yes, thank you so much. And thanks all listeners for participating. This has been fun as usual. And we're going to continue on with Asking Me Anything next time around.
I love it. It's always one of the best hits that we get. The people really seem to enjoy participating in the show. And
so do I.
Well, good. It does. It seems like a constant pop quiz for you, and you always ace it.
If you would like to join and support the most amazing radio station on planet Earth, then please consider stopping by the tip jar. Help support this show and this amazing family that supports this radio station to give us such wonderful news and crazy good music. There's some kind of music for everybody on this station, so please think about supporting it so that we can continue spreading this joy for everybody.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. And Sage, thank you for answering the phones today and all that entails. This show would not be possible without your assistance. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.